Dr. Ezana Azene is an interventional radiologist at Gunderson Health System. He's here today to talk about treatment options for uterine fibroids. So first of all, just start us off. What are they?
Well, Martha, they're very common. They're the most common benign, that means non-cancerous growth of the uterus in women. About 70% of women have uterine fibroids by the time they turn age 50.
So what are some of the symptoms, or if they're really problem-causing fibroids? What happens?
Well, about 20% to 30% of women who have fibroids can experience symptoms like heavy bleeding during their periods, more frequent periods, abdominal pain or pressure, or trouble becoming pregnant.
And that's a big deal. And in the past, as far as treatment options went, a lot of times it was pretty serious surgery and long recovery periods. But there is something new that's available. Give us an idea what that's called. It's UFE or UFE?
UFE, right. It stands for Uterine Fibroid Embolization. And embolization means cutting off blood flow. And basically what we do is take a very tiny catheter, put it in an artery in the woman's groin, as you can see on this graphic, and then advance it to the blood vessels that supply the uterus. And then we inject millions of very tiny plastic particles to shut off all the blood flow to the fibroids. And without blood flow, the fibroids die and then they become smaller. And about 90% of women have significant symptom improvement.
Okay, and the big deal here is that for a lot of women, before a lot of the treatments before this for fibroids would be maybe a hysterectomy. So complete removal of the uterus, which means, of course, now you have no options as far as having your own children. So for people who go through this, what kinds of options are still available to them?
Well, people who undergo uterine fibroid embolization don't have a scar after the procedure. They can become pregnant in the future, and they can still have additional procedures or surgeries as needed if the fibroids recur.
Okay, and one last thing, as far as the recovery time, what are we talking about?
Well, some women can go home the same day as the procedure, but most women go home the following day and they're fully back to their normal activities in about 3 to 5 days.
Oh, well, Dr. Azene, thanks so much for joining us today, too, and explaining all that.